to ask questions, and that's going to be key. So, without further delay, please join me in welcoming Ryan Wade.
Thanks for making the time today, everybody. I'm going to share my screen here. Does everybody see that okay? So we're going to be talking about DBT skills for recovery. And so we often refer to it here as DBTS, dialectical behavior therapy for substance use. First disclosures, unfortunately, no one is paying me for this, so I have no conflicts of interest to report. We'll start with what is DBT. We use it a lot over here at Silver Hill, so sometimes we forget that not everybody knows what it is. It's a somewhat common treatment modality, across the U.S., though not too many treatment centers utilize it primarily. In fact, I actually found out today Silver Hill is one of 3 residential treatment facilities that use DBTS in the country. So we're one of 3 facilities that are actually using this for dual diagnosis purposes in treating substance use disorders. So a brief primer on DBT. It was developed from cognitive behavioral therapy. One of our longest standing types of therapy, has probably the most evidence behind it in terms of in treating many different psychiatric conditions, anxiety, depression, insomnia. Dialectical behavior therapy was an offshoot of that, looking to treat borderline personality disorder, and primarily focusing on treatment of emotional reactivity. There's a lot of all or nothing thinking that comes up within borderline personality disorder, and oftentimes self-harm behaviors, or frequently suicide attempts, fits of rage, just sort of this very intense emotionality. And so CBT oftentimes wasn't adequately addressing these sorts of things, as it focuses a lot on thoughts, and part of the difficulty that these folks were experiencing was really related to the intensity of the emotion. And so Marshall Linehan was the original developer of this, kind of modifying CBT and adding things in along the way. Early on in the process, really involved mindfulness practices that were added to a lot of the cognitive type exercises. The main differences, obviously a lot of differences, that if we had to distill it down, and we'd look at the fact that DBT focuses primarily on emotions and how it relates to the behavior, whereas CBT is focusing on our thoughts and how they influence behavior. And so there are going to be a couple figures that I kind of shamelessly took from the training I received in DBT, because I think that they sum things up more effectively than I can. This triangle kind of demonstrates how we have this relationship between emotions and behavior, where DBT is really focusing on, or CBT is looking more at the thoughts. There is some overlap in some of the techniques that are used within cognitive behavioral therapy and dialectical behavior therapy. We still look at behavioral analysis, which should be, looking back at prior events and trying to determine, all the things in the process that led us to that behavior or that poor outcome, and almost like a root cause analysis that some might do at work or in a business setting, but looking at it for our own actions or behaviors. There's self-monitoring. One of the most commonly employed tools in DBT is a diary card, where people are rating a number of different aspects of what's troubling to them in terms of different emotions or different urges, different needs, and kind of just assessing those daily, taking the time to monitor ourselves and see what kind of trends we can notice in terms of our mood from day to day, if we're taking the time to rate it every day, or we'll see within substance use disorders, cravings or urges to use. In traditional DBT, it might be looking at thoughts of harming oneself or something of that nature. And there's a lot of teaching that goes on as well. DBT is a skills-based therapy at its core. and we'll get into some of the skills in the modules. A lot of it has to do with practicing skills to kind of keep our head in the game, so to speak. The nice part after DBT was really developed is that we've found more ways to adapt it to treat different conditions. We can use it in various settings. Here at Silver Hill, we operate in basically a residential level of care, and it's really useful in that setting. Though we also have an IOP that uses DBT. There are outpatient skills groups. There are outpatient DBT therapists with one-on-one work and coaching and that sort of thing. So it can be broadly applied and kind of adapted to treat a number of different things, which is why we seem to be so fond of it over here at Silver Hill. The other part, for anyone that has any experience with DBT or starts learning it, there's a lot of acronyms. And I tried to refrain from using too many of them. There are some examples of them at the end. Just about any skill or any sort of lesson that you could get in DBT, there's an acronym for it. And it's an attempt to make information digestible so it can be taught and remembered. And oftentimes, these are intended to be used in times of high emotionality, times when we're feeling really distressed, or times when we're feeling that quite intense emotion. And so it's a lot easier to remember an acronym or a short word and then process through it, as opposed to all the things the acronym might stand for. It's going to be a little easier to pull up in the moment. And so the dialectic philosophy, if you go through, or at least when I was learning about it, there's a lot of convoluted stuff about the dialectic philosophy, and all of it makes sense on its face. Though it's these really wordy, sort of nebulous ideas. No position is absolute, and you can gather wisdom or you can gather truth from anyone's perspective. And the idea being that it doesn't have to be black and white. It doesn't have to be this or that. In fact, opposite views, black or white, they're often interconnected. You define one by the other. And so there's often some gray area somewhere in the middle. It would be difficult to understand black or white without the other. The concept of situations being fluid, change is always continuing. The context that something happens in matters, right? Something is not always or never one way. The context can change these kinds of things. And the hope being that by combining all of these ideas, opposites, and the context in which these things are happening, can enhance our understanding, promote balance and change. A lot of these are kind of taken verbatim from, or snippets from verbatim of the actual philosophy of dialectics and dialectical behavior therapy. Really what it comes down to is more than one thing can be true at the same time. That's the take home message from the wordier philosophical approach. And a big part of this is to try and reduce all or nothing thinking, which manifests oftentimes within borderline personality disorder, where this was developed, though we can see this kind of detrimental thinking within anyone, really. And one of the fundamental viewpoints of dialectic behavioral therapy, we want to be accepting and we want to be pursuing change, right? You want to validate the experience of someone, you validate the emotion of someone, and we also want to challenge them for the purposes of change. This person is out here trying their best, and we want to try and do better. That's why we're here. That's why we're working on things. It's not to suggest that someone's not trying hard enough or that they're incompetent or anything like that. They're legitimately out here doing their best. At the same time, like we can try to do better. We can work on skills. We can educate. We can coach. We can help someone do better. A few other common dialectics, just examples of ones that we see within really any form of mental health, though I think you'll you'll pick up that some of these really do apply to substance use disorders, to addiction, that sort of thing. You know, you want to be caring and loving and hold someone accountable. You know, we think of, you know, unconditional positive regard for those we love, though, you know, there comes a point where we also have to hold someone accountable for actions. Similarly, we want to be available, we want to be able to assist others, we want to be able to help, but we also have to set boundaries and set limits. You know, we want to be supportive, yet we don't want to be enabling. We want people to be able to seek help, and we want people to be able to be self-sufficient. It doesn't always have to be one or the other. And that's where these dialectics come into play, is that, you know, we can see people doing all of one of these things and none of the other. And ultimately, we want people to be able to do both. You know, the truth is going to lie somewhere in the middle, somewhere in the gray area. We want to be able to tolerate things, and we also want to be able to problem solve, take action when it's appropriate. We don't want to have to be tolerating something unpleasant all of the time, though there will be times where we have to, so we want to be able to. And this one particularly, what we see for a lot of folks that are leaving treatment with us after completing treatment, there's a balance between wanting to remove any triggers for use or any stressors in life, and we also want people to be able to deal with these sorts of things. You know, that's part of why we're doing a lot of the work that we're doing with folks, so that when they return to life, they'll be better equipped to deal with these things. Though, you know, we also want to try and set people up for success, and why have these unnecessary stressors and triggers and things that are going to potentially, you know, disrupt their recovery. And so DBT directly for substance use disorders, a little more pointed common dialectics. People want change, people want to achieve abstinence, and there are desires to continue to use for whatever reason it may be. People are using substances for many different reasons. You know, we see all the time within working with addiction, ambivalence is prominent. And ambivalence is essentially considering both sides of a dialectic. You know, they seem to be opposing, though both of them can be present in concert. You know, wanting relief and wanting sobriety. You know, for some, use of a substance or alcohol, it's alleviating an unpleasant sensation or emotion, and they tend to work rather quickly. You know, so that they want that relief that the substance or alcohol may provide, though they also want sobriety. They are looking forward to a healthy, stable lifestyle, and that there can also be something enjoyable to them about drugs and alcohol. These are things that we're seeing all the time, and to acknowledge that both of these things are true for folks, I think really helps them to get to a place where they can understand why it's been so difficult. And when we're using DBTS in particular, the focus is on the substance use or as the problematic behavior, you know, compared to traditional DBT, where the self-defeating behavior is often, you know, the way people are either self-injuring or the way they're acting in relationships, that sort of thing. The primary focus for us is looking at substance use. So we've gotten to a point where we've identified that as a significant problem for someone that's coming into a treatment program such as this. And so that ends up being where we're focusing with a lot of the skills that we get to. It's important to note that it does actually pair quite well with other therapeutic interventions for substance use disorders. And so the point of this is not to say we should replace everything with DBT. It can be used in conjunction with other more commonly used treatment modalities. Motivational enhancement therapy or motivational interviewing, the focus is on ambivalence and goals for the future and that sort of thing. And being able to, you know, understand the dialectic and kind of work with a patient within the dialectic really helps them to explore that ambivalence. 12-step programs focus on acceptance. They focus on change. You know, our one of our primary tenets of DBT is, you know, accepting what has happened where we are, trying to accept the reality of what state we're in, as well as pursuing change. You know, we're all here, we're all working in DBT because we're trying to get better. And then medications are universally accepted as part of the treatment plan when we're working with DBT as a treatment modality. And so that can play a beneficial role in all of this. So we'll go over kind of like high level, the different modules in DBT. There are 4 kind of pillars of the idea of the therapy. And then we'll touch on kind of how those apply to substance use disorder specifically, and go through a couple examples here in the wrap up. So there are 4 main skills modules. Our program here at Silver Hill spends a week on each, making it a 28-day program. There's mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. And mindfulness, it kind of underlies all of these, you know, being able to be in the right frame of mind, being present so we can be able to work on these things. And mindfulness really allows us to utilize some of the skills that we'll touch on. Though it's all of these kind of have an equal amount of time spent on them in the treatment program. The elements of mindfulness that are going to be most prominent in terms of improvement. And again, when we're teaching these kind of things, we're doing so over many hours over the course of the week. So I apologize if this is rather reductive. We're looking at mindfulness. We want to be balancing emotion, balancing logic, and what they refer to as the wise mind. So we've got our emotional mind, our very rational mind. And the truth, again, lies somewhere in the middle. You know, we're not always going to be thinking 100% rational. We can't necessarily be making sound decisions when we're 100% emotional. We want to be blending the two. Being able to observe oneself, observe your surroundings, kind of being able to describe feelings, describe what's happened, describe in the process of something, and trying to do so objectively and rather concisely, so that we're not introducing too much of our own emotion into a situation and can actually have a functional conversation about things. The stress tolerance, you know, these are skills that we try to employ when we recognize that, hey, there's a problem and it's causing stress and I can't fix this right now. You know, if this is not something that I can take action and resolve, how do I go about tolerating the distress that's arising from this problem? And this is where radical acceptance often comes into play. And this is a large part of DBT as well. Being able to accept what we have to deal with, you know, accept the things we can't change. And that's part of what gives us that capacity to tolerate some of the more distressing emotions or distressing situations. Within emotion regulation, there's a lot of education on emotions, you know, how they're contrived, how they develop, what kind of things influence them, as well as focusing on things that can kind of reduce the intensity of these emotions. So some of these are coping skills in the moment when emotion is getting high. Though some of these things are preventative measures. You know, we're spending time focusing on self-care when we're trying to have positive experience, build mastery doing something. You know, banking some good interactions, some good accomplishments, so that we're starting from a better place. So if something distresses us, it's less likely to take us over the edge. And interpersonal effectiveness focuses not only on our relationships and how to more effectively interact with others, it also starts with a focus on how we can go about respecting ourselves, and so that we kind of have this good framework to conceptualize ourselves. So if we're advocating for ourselves or requesting something, trying to set a boundary, that we are valuing ourselves, so that within forming these relationships, we can be our truest self, and so we can be effective in maintaining this. And a big part of that is validation, which could be its own talk on validation and how we can use a little more of it, though it's a fundamental piece of DBT. And so quickly within these modules, when we're trying to apply this sort of thing to substance use disorders, wise mind we're talking about is it's critical to recovery because it's how it helps us stay realistic. We're not going to be overconfident about leaving a treatment facility because we're in, completely logical mind. And I know it's bad for me to drink or use whatever substance, and I just can't do that. It caused so many troubles and I'll never touch it again. Okay, well, in your wise mind, you can appreciate that there are risks out there. There are things that may make it more likely. There are things that can tempt you. And so to be more thoughtful in the plan. It also helps being able to identify, these emotions, being introspective, being able to discuss emotions and identifying things that can influence those emotions. And a lot of times that can help us to figure out what our most significant risk factors are. With distress tolerance, if we're better able to diffuse or endure distress, we're going to be less likely to seek out a substance that might alleviate an uncomfortable sensation or an uncomfortable emotion. If we feel like we can regulate that and manage it ourselves, we may not be looking elsewhere for something to take away that sensation. And oftentimes when folks are coming in for treatment, there's a good amount of guilt or shame even about what has transpired to bring them here. What actions have happened recently or what consequences from substance use or other behaviors. And radical acceptance can help us to start processing this sort of thing. And if we're not feeling shame and guilt, also rather intense emotions, we're less likely to be looking externally to soothe that like we would for alcohol or other substances. With regulating emotion, if we have a little more insight, we can theoretically understand what's going on, or we can try and prevent any sort of reactivity or impulsivity that might arise from intense emotion. And in doing so, like in trying to preempt a lot of that, the improved self-care, the focus on self and our needs, we all have like a greater capacity to deal with more intense or distressing things. People tend not to, boil over at work when they've just gotten back from vacation. They've kind of banked a little bit of that, care for self. They have a little bit better of a capacity to deal with, the stressor of a work day than they would if they'd just been working for the last 14 days straight. And so self-care is kind of that way to take some time for yourself and recharge a little bit. So if things are particularly emotional, we have more of that bandwidth, so to speak. And interpersonal effectiveness, if we're improving our relationships, if we're improving our communication with others, we're going to have fewer heated arguments. We're going to have, fewer, marital disputes, family disputes. There's going to be a greater sense of stability. And we've got that greater sense of stability and less of that, intense emotion arising and less of that distress. We're less likely to look towards substances to help kind of ease this or soothe this. And validation can be a great tool within that to help lower the temperature, so to speak, in conversation. If someone is very frustrated and they're coming in hot, if validating their concerns can kind of help take the temperature down a little bit and can be more effective conversation. And so just a couple examples of like how these tools are, these skills are kind of implemented or disseminated when we're working with folks. A lot of them come in acronym form. And so I took a couple from the interpersonal effectiveness model because there are dozens, there might be over 100 acronyms. I'm not really sure. There's a lot if you're going through all of it. So I just took out a couple that can demonstrate it. When we're looking at how do we be more effective in respecting ourselves, one of the acronyms would be FAST. We want to make sure we're being fair. We want to make sure that we're not apologizing unnecessarily. We want to make sure we're sticking to our values and being truthful. All of these things demonstrate that you're going to be you're respecting yourself, and that not apologizing for something that wouldn't necessarily require apology. You are maintaining your values. You're not bending them for someone else. You're being truthful, which is likely one of the values for most folks. And it's simple, though it makes it a little easier to teach and just kind of like a bite-sized chunk if you have an acronym. This other one is a little bit longer, which is why an acronym might be more helpful in terms of teaching it. But if we're looking to set a boundary or to request something that we need, one of the most commonly used ones for this would be Dear Man. And if you read through it, a lot of it can be intuitive. Like, yes, it makes sense that you would do all of those things. Though in teaching it and giving some folks like an actual framework with which how to think about this, it can be really effective for them to pick it up. You know, if you're going to request something, you know, describing what the situation is, express your thoughts on the matter, make sure that you ask or assert what it is that you want, and then you can reinforce, reinforce the interaction, as opposed to, you know, if it's not going in the manner that you'd like, as opposed to punishing someone or what have you. The man part of it is just kind of how you'd conceptualize it, making sure that you're staying on task with the issue, being mindful of things, the appearance of being confident, and then you can always negotiate. Like these are ways that you can remain effective and rather objective. And so the acronyms can kind of help to transmit a lot of that information so people it's conceivable for folks. But there are dozens of those all throughout the different modules and trying to teach skills that are actionable. So, and with that, I'll turn it over to Jess to talk about like how she's put these kind of into action or how these kind of things have helped her.
Thanks a lot. Jess?
Hello, everyone. My name is Jessica, and I am a recovering addict alcoholic and very satisfied DBT customer. Just a brief background on my story. I spent 28 days at Silver Hill. I was admitted in June of last year, and I went home in July. So I'm coming up in a few weeks. I'll have 1 year of continuous sobriety, God willing. My story starts long before then. I'm the child of an alcoholic. My father spent time at Silver Hill when I was a child, so I knew of it from familial experience. My benchmark comparison for alcoholics and addicts was very skewed, coming from an Irish Catholic family where holidays were somebody was passed out or drunk and it was normal and you just walked by them and you ignored it. So in my eyes, I was not an alcoholic. I had a job. I have a family. I went to college, albeit much later in life. I always kind of felt like I didn't drink the way that normal people did, and that whatever normal is, and that my head didn't process the way that the rest of the world did. There were several times in my 20s that I kind of hung out with people that would encourage me to drink more. And I definitely dabbled with drugs in my 20s. And, I have a mood disorder, and in my life, the way it presents is that it presents with stability for a year or two, or sometimes even 3 or 4. And then that impulsivity kicks in and the mood disruption kicks in. And I've managed to sever some good relationships, to ruin some great jobs and such. It just kind of, I rolled through life that way. I got married in my 30s. My husband and I have a lovely son, and things were pretty smooth sailing for a long time. I'm a nurse, and the pandemic hit, and I cannot sit here and say the pandemic is what accelerated my alcoholism. I just think it was kind of a contributor to the perfect storm. My marriage started to pretty much collapse, and I thought that it wasn't my issue whatsoever. And lo and behold, almost a year sober, it was entirely my fault. Well, I mean, it takes 2 to tango, but who knew? Taking a little accountability goes a long way. I started drinking heavily. I don't, like I said, I always felt like there was something wrong with the way that I drank. I just didn't, it wasn't as bad as everyone else's, so I didn't really think I was an alcoholic. But over the last couple of years, I started drinking wine daily. I was prescribed Xanax during the pandemic for dealing with PTSD, anxiety, panic attacks associated with, being a frontline worker during that time. Um, at that point, my primary care physician was like, here's 61 milligrams Xanax, take, as needed. And it was a 30-day prescription. And, I was like, well, I'm taking it regularly, but I'm not abusing it. But I was drinking alcohol, and I became a blackout drinker very quickly. Um, the lying and the deceiving and the cheating and everything started happening, maybe in 2019, 2020, right around the, a little before the pandemic, a little bit after. I was drinking every day. My husband would be upstairs, like putting our son to bed, and I would be turning on the faucet so he wouldn't hear me open the refrigerator door to pour more wine. I had wine, vodka in my water bottle, bringing my son to swimming. And I just didn't know how to get out. I was on this hamster wheel, and I knew it wasn't normal, but I did not know how to cope. My marriage was in turmoil. We were constantly fighting and bickering, and I was constantly lying. And I just blamed him for everything. I'm drinking so much because he's so controlling. And why won't he just like let me just live my life? And it was, I look back now, and it's hard to think that I ever thought that way. But to bring me to my bottom, there was a series of events that happened. I got into a car accident with my 5-year-old son, and it was very minor, but I don't know how I didn't get a DUI, most likely because I am a nurse in the town that I work in. The other thing, my husband kind of knew, and I vowed I would never drink with him in the car. A month after that, I had a blackout episode at home, and my husband was trying to calm me down, and I called the police on him and said he was trying to hurt me. And I really don't think he was. I think it was the manipulative me. And I didn't remember any of it. And I woke up the next day, and it was his birthday, and I swore I'd never drink alcohol again. And that was April 8th of last year. So for 60 days, I did not drink, but I also didn't have a program. I kind of thought, I'm a mom. How can I go to rehab? Like, who's going to take care of my son? Not realizing, hello, you're not taking care of your son. Until in June, my life really started to unravel. My husband kind of, all the lying and the cheating came to a head, and he was made aware of some things that I'd been hiding for a long time. My alcohol and drug use he became aware of that. And when he was in Florida for a work trip, I decided I didn't want to live this way anymore, and I didn't know how to find a way out. So I put our 5-year-old son to bed in our bedroom, and I chased 3 or 4 Xanax with half a bottle of whiskey, and called family and another friend and said I didn't want to live anymore. And that was June 12th, 2021. The day my life changed forever. And I get chills now, but really I'm so grateful. And for me, it took the gift of crisis to change my life forever. An intentional overdose is something that's very difficult to come to terms with, and the guilt and shame around it going into treatment was something that was impossible for me to accept at first. I spent 3 days in the hospital that I worked at. I was an ER nurse for years, and I was in the ER on a psych hold for 3 days before going to Silver Hill. A very humbling experience. I was transferred to Silver Hill, and then I spent 28 days in their transitional living program, where my life absolutely changed forever. I was in such a state at that point, I didn't know what to do, but I also knew I didn't want to die. But I didn't want to live in the way that I was living. And at that point, I was just so desperate. I'm like, let me just give it a shot. I was so miserable for so long. And what did I have to lose? And, I just wanted to be there for my son. And he's my life. I'm the mother that never wants to be without him. And I spent those 28 days thinking, did I even kiss him good night before I did that? And, those are the things that haunted me. But I quickly decided that if I was going to do this, if I was going to get sober for good, I was going to throw myself into this program, which I did. All these things that Ryan's talking about, the acronyms and this and that, it's funny to hear it now, because hearing it a year ago, I was like, when it was first I didn't understand it at first. And it's interesting because I was just speaking before, a year later, I do it all the time without thinking about it. I still have this like cheat sheet of DBT skills that was given to me at Silver Hill by my resident counselor. And, I go to it and it's changed my life. Coupled has Dr. White had said, medication, 12-step program, all that is a process. For me, I am an active member in my in Alcoholics Anonymous in my home group. I do take mood stabling medication. So it's like a whole, it's all very, there's a lot of parallels, but it's not just, okay, I did DBT and I graduated from it. There's no graduating from an active, from an addiction. It's a daily process for me. But as far as DBT is, there's a few skills, especially in the beginning, which like they're the reason why I'm still here. And radical acceptance is one of them. I went in and I would sit there and cry every day because my son was in my care when I had the suicide attempt. I had DCF in an active DCF investigation. I was not able to have unsupervised visits with him. I mean, at that point, it didn't matter because I was in treatment. But when I came home, I had to spend 2 to 3 weeks, I think, with my in-laws helping me until my investigation was closed, which it was. Thank God it was closed. But radical acceptance was such a big tool for me because I couldn't change it. I couldn't change what I had done, but I could accept that there was nothing I could do but just do better. So acceptance was the answer for me. And there's that parallel with the step, 12-step with AA is like acceptance is always the answer. So I learned very quickly that was what was going to set my brain free. I wrote down a few things as Ryan was talking. I'm very much an all or nothing person. That's the way it always was. It's the intensity of emotion that got me into so much trouble, but it's DBT and AA that having the combination that has saved me. The ability to pause, stop is a skill, instead of like having a knee-jerk reaction to things now, especially in my marriage. I just take a pause and I take a break and I try to get into my wise mind. I can sit here and talk to myself like, am I in my emotional mind? And if I am, I take a deep breath and I walk away and I wait a few hours and see if I'm, and it usually doesn't bother me in a few hours. I'm looking at all the things I wrote down. Opposite action has been a big one. I'm a big avoider. Like, I don't want to pay bills. I don't want to do this and that. I mean, nobody does, but it would give me so much stress and I would just leave things. And now it's like when I feel myself doing that, I'm like, just do it. Just do it. Like opposite action. Like I'm going to just avoid something. I know I'm going to avoid something. So let me just do it right away. Honesty has been the biggest thing for me. I didn't realize until I stopped lying how much I lied. And I lied so much that I told myself different stories to myself. Like I lied to myself, as well as lied to everyone else. But I think now it's like, I can't lie because I know if I lie, it's the beginning of a relapse for me. So being honest and open it's at all costs. Like I'm extremely grateful to report that my marriage is better than it ever was. And it survived so much. I thought I had really severed it, and my husband is supportive and we don't fight because I'm not sitting here trying to poke the bear constantly. I take accountability. I admit when I'm wrong. And, it's just such an easier, softer way. And honesty is really at the forefront. I had no idea if I just told the truth, like all these years, life would have been simpler. But, lo and behold, here I am. Tips was another one I wanted to say. I get panic attacks, and something called tips talks about it's physiology. Like I wasn't going to butcher the description of it, but basically I was a person that couldn't get on a plane without taking a Xanax, like not even step foot on it, like not even get to the airport. And I knew when I entered Silver Hill that I would never be able to take a benzo at any cost. It doesn't matter that it's a drug that is prescribed. I knew that was mind altering substances for me, or just they aren't something I can ever consider taking. So I got on a plane for Thanksgiving this past year with ice packs in my purse and was probably looked completely out of my mind on the airplane, but like, tips talks about using temperature to change your physiology. And I did, and it worked. And it's just like, I was such a cynic about that at first. And to think that something so simple like temperature change, like a cold shower, can really alter your mental state in 2 seconds is amazing. I don't think there was anything else. Wise mind is a big one. I just, in mindfulness, never, all we're ever given is this minute. And I was thinking about that right before getting on this meeting, because my son, who's now 6, was like exhausted, and I was like just cuddling with him. And I used to take those moments for granted. I used to always be thinking about other things and probably thinking selfishly, but then laying here with him before this meeting, I'm like, oh, I love this moment. And that's really all we're ever offered, is that one moment. I'm just, I'm really grateful that I have these, that have been given this opportunity. I think Silver Hill is it's an amazing place. I'm really grateful I got to have the DBT school. I joked when I was there that this is like life school. Like, I don't think I ever learned how to be a human. And then I became a human at 41 years old. But life is good. Life is better than I ever thought it would be. I can't wait to see what the future holds, because today is just amazing. I've done a complete 180. I'm so grounded. I hear people say now, a year later, I had no idea you're an alcoholic. And, my reaction is usually, I was that good. I was that manipulative. Like, I could have sold, like, whatever the expression is, I could water to a camel. That's how manipulative I was to everyone, including myself. And, the damage in my disease was in my home. And it was, it was like a atom bomb in here. So when I look back to, there are people that kind of knew what was going on, but I look back and I'm like, I just, yeah, you probably didn't know, but I can finally say that my insides finally match my outsides. And the exterior shell was a good show, but today I'm like saying it completely honestly, like, my life is great. My life is good. I never in my million years thought I'd be able to sit here and be sober and be happy. And like I said, I was really gifted with that gift of crisis, because I knew, like, I never wanted to touch another drink or pill in my entire life. Like, I knew the jig was up. And, there was a few times in my life where I thought I would give it up here or there. Oh, but my life's better now, I don't need to. But, in a year ago, I knew that, like, because I still know today, if I were to pick up a drink or a drug, like, my life would be over. I'd lose my child, I'd lose my husband, and probably lose my life. So I don't take a minute of it for granted. I put alcohol before the most important thing in my life, and that's my son. And I put my son's life at risk. So because I did that, I'm in constant reminder that I need to put my sobriety first above anything, because without my sobriety, everything else, the rest of everything goes down the tubes if I don't maintain that. And thanks for reminding me about self-care. I've been much better at it, but it's a huge part of recovery. I exercise most days, and I eat right, and I sleep. So there's all these components, and I'm grateful to be here and talk about it. I'm fortunate to have a very supportive surroundings. I was telling Paul, one of my closest friends and my supervisor, has been very supportive of my journey, because unfortunately we lost her son 5 years ago to this disease. And she's been very supportive of my recovery from a very personal standpoint. So I was really happy to be a part of this group, because I know it would mean so much to her, for and my own parents. My parents have 2 children that are in recovery, and my dad's in recovery. So the education is just the biggest component of, it's a family disease. I know it firsthand. Child of an alcoholic, it's a family problem. And I'm sad my husband has to be a part of that equation too. But you know what, I'm grateful today. And thanks for letting me come and share my recovery story. I hope you got something out of it. And thanks, Ryan, for the DBT refresher.
Do we have any questions for Ryan or Jess? We have time. Rich?
Yeah, is there a program outside of inpatient where you can access a DBT program? In other words, let's say you've been sober for a period of time, but you're having some trouble, you're working and doing your best, but still having some trouble maybe coping or adulting, to use the term. And it sounds like this might fit the bill for someone who maybe has a bit of sobriety under their belt, but still is having some emotional regulation and behavioral challenges. Can you do that outside of a 28-day inpatient program?
Yeah, definitely. And a lot of the DBT skills are life applicable. It's not just towards mental illness or substance use disorders. A lot of these things are just kind of things you can use day to day. It doesn't have to be an inpatient or a residential stay. There are, I know we have an intensive outpatient program that does it, which is, it's 3 hours, 3 days a week done virtually. There are outpatient clinicians who will do like individual therapy sessions that practice DBT. I think there are a few actually like within this area that do that. But it can be done in any setting really. Because it's so structured, it lends itself to a residential setting where you have a time limited amount of time that people are here, and you can dole out all these modules like in a certain time frame. So that's part of why it's such a big part of our curriculum, but it can be done on an individual basis, on an outpatient basis as well.
Thank you.
I think part of it is that individual therapists offer it. I've heard in New Canaan they have like a weekly DBT skills class. Although when that kind of thing is happening, I assume that they've already gone through some kind of structured program. But that's pretty interesting what you said, Ryan. I think not before we started that, or maybe it was after that, Silver Hill is one of only 3 treatment centers in the country that is doing this for co-occurring disorders.
Yeah, so I learned that today actually. There was we had one of our directors from like our board of directors was here, and we were meeting with him. What I learned was we are one of 3 residential facilities in the country that uses DBTS as our core therapy for dual diagnosis for co-occurring disorders. So I think there are many DBT programs looking at the emotional regulation, the self-injurious behaviors, those sorts of things. But to have a treatment program that's primarily DBTS, using DBT towards reducing substance use, there are 3 residential programs in the country, supposedly. I don't know who has that database, but that's what I was informed today.
Wow. What about?
Sorry.
Go ahead, Jess.
I was also going to add to that. So when I left 28-day transitional living, I did the IOP through Silver Hill, which I think Ryan had mentioned. So I did 3 days a week, 3 hours a day. So I spent, I think 6 to 7. I think it's an 8-week program, but I went back to work. So I did it in the interim for 6 weeks, and I have a lot of friends in recovery, long-term sobriety, that have gone back and done an IOP because it is such a great program for recovery. So I know a few people that have been in AA 7 years and then go back and do an IOP with DBT.
I had another question. If I'm a parent, can a parent bone up on DBT skills that would help them in their relationship with their loved one?
Yes. What I would say is what a lot of folks come to recognize after leaving a program like this, and they've really worked on their interpersonal effectiveness and being a good communicator. I think what people tend to notice after leaving is there are a lot of bad communicators out there. there are a lot of people that aren't all that effective. And you know, it's not to say that if they don't also have DBT training that it's pointless. What it is very good for is you become much better at not having arguments escalate. And that's really a big part of what arguments are. You know, people have disagreements all the time. It doesn't always have to be an argument, so to speak. It doesn't have to become an altercation. And the ability to, you know, validate someone else, to hear them out, to not escalate your own kind of response, that can promote more effective interactions. You know, we can kind of keep it from boiling over, so to speak. So it can be helpful for folks to, you know, to work on some of that, and just, it'll diffuse situations a little bit better. It won't necessarily make them any better of communicators, or them any more effective at advocating for their own needs, or, you know, forging relationships. So you can certainly keep things from becoming a little more toxic, so to speak.
I see a couple of therapists in the room. Do either of you want to offer up whether you use DBT as part of your therapy? Don't have to. I don't want to call you out, but
I can go ahead, Paul. Hi, how are you? Jess, I just wanted to say that I'm so proud of you. Great job, really good job. And yes, I definitely use DBT as part of my practice. I think that I use a combination of CBT and DBT. Ryan is right. There's a million acronyms, and that can be a little off-putting to folks at first, and feeling like there's a lot to remember. But I think the principles and practices are really useful, and that people can really grasp it onto quickly.
thanks for that.
Yeah.
Does anyone else have a question? Cole, you unmuted.
Yeah, I was just going to say, DBT is pretty foundational to my practice as well. You know, what I like about DBT is, instead of it's a doing therapy. You know, it's something that you can do in the moment. It gives you a behavioral toolbox to grasp for when situations arise. And I don't know, I always think of DBT as training people to be their own best DBT therapists. You know, ideally it's getting people to stop, you know, not needing to rely on a therapist or, you know, that, you know, type of support, and being able to empower themselves and yeah, self-regulate on their own. So I also, you know, I just believe in it. I mean, I use DBT skills myself. I'm a therapist, and, you know, part of my training was utilizing them on my own, in my own life. And so I from personal experience, I know that it can be really helpful to building that satisfying, livable life. So.
Okay, one last time. Anybody have a question and that they want to get out? Well, if not, but, you know, I myself am just heartened every time I hear a person of courage, you know, courageously tell their story and do it, because I think those kinds of stories are the best way to educate people. And so thank you, Jess, for doing that. And Ryan, thank you for going through all those acronyms, but not overwhelming us. And Susanna, thanks for getting Ryan and coordinating this. I really appreciate it. So with that, I just want to thank you again. This has been just so helpful. Thanks. And with that, it was good to see you all. and enjoy the rest of your evening. Susanna, you want to say anything?
No, I was just gonna wish everybody a good evening.
Yeah. All right. Thanks again and take care,
thank
everybody.
you, Ryan and Jessica. This was great.
Bye now.